It is not a matter of if, it's a matter of when, and an emergency can happen at any time. Most people want to help, but sometimes the things that we were taught are just wrong. And when you do something wrong in an emergency, it can make the situation worse. And so today we're going to cover 10 common emergency mistakes that most people make. And we're also going to talk about the things that we should be doing for those emergencies. And during this video, I want you to go ahead and keep tally, keep points for yourself on these 10 emergencies and see how many of them you actually know how to respond to. So the first mistake that most people make is when somebody's having a seizure, people try to stuff things in that patient's mouth. You might try to use your fingers, your wallets, you might try to use a spoon. And I'm here to tell you today that we're not supposed to be putting anything in these patients' mouths while they're having a seizure. This person is not going to swallow their tongue, and so by sticking stuff into their patient's mouth while their mouth and jaw are clenched down while they're having a seizure, we might start to break the teeth. We might start losing these teeth inside of the closed mouth that we can't open up, and that might cause a choking hazard. The things that we're stuffing in the patient's mouth, maybe you do happen to get it in between the teeth, and now they bite down and they take it off, and now that's stuck inside of the closed, clenched jaw. And now we have a choking object, a choking obstruction, or at least the potential for it. So once we realize somebody is having a seizure, what we're supposed to do is, if they aren't already on the ground, help them get onto the ground just so they don't fall out of their chair, fall out of their bed. And we want to move things out of the way that this person could hit their body on. We also want to consider holding up their head so they're not hitting their head on the ground, or putting a pillow underneath their head so they aren't hitting their head on the ground. We also want to start calling 911, and if you're not able to do it yourself, hopefully somebody else you're with is able to do it, or you're just going to wait for that seizure to stop so that we're protecting the head, protecting our patient. And then once the seizure stops, then we're going to start calling 911. We also want to place this patient into the recovery position, and this is going to be on their left side. And so you're just going to roll them over, roll them up onto their left side, and that'll be what's known as the recovery position. The second mistake that most people make is just putting ice on a severe burn. You know, when somebody gets burned, the first reaction, the first thing we want to do is start to cool it. And what's the coldest thing that we have access to? It's ice. And so most people, they're going to take ice, bags of ice, ice cubes, or just take a bucket of ice and put it onto that burn. The issue with ice and the issue with cooling severe burns is our skin is what helps thermoregulate us. It helps control our body temperature. And so if we start putting ice on a severe burn, especially if it's over a majority or a large portion of the body, we can really start cooling the body too much, and we can also start causing some ice burns to this patient. Hypothermia can start being caused as well. And this is going to cause more tissue damage for the patient, and so we want to try to avoid just placing direct ice onto that burn. Instead, what we should be doing is we should be removing this person from that hot environment, from that heat source. If it's some sort of chemical, try to brush it off, dry it off. If it's like a physical thermal type burn, if it's something that was actually burning the patient, move them away from it. We don't want them to be close or near to that burning object or that burning item. We also want to start removing jewelry and clothing from the burned area. Now, if the clothing is melted on and is stuck in the wounds, don't try to rip that out. Just remove what you can, but we really want to make sure we remove the jewelry, the rings, the necklaces, the bracelets, because as these areas burn, they will start to swell up. And then it's going to be a lot harder to remove, and it will start causing more damage for your patient. We also want to use something that's cool, like cool water. We don't really want to use ice, but we do want to use maybe some cool items for very specific areas, for minor burns, more minor burns. But again, if it's a majority burn, full thickness burn, we are not going to be using these items. We just want to keep it dry and sterile. For any type of extensive or electrical or chemical burns, or any burns involving the face or the neck, the chest, we really want to consider just going ahead and calling 911, really for any type of injury, but especially for these ones. Call 911, have that process started as soon as possible. The third emergency mistake that we're going to cover is tilting your head back while you're having a nosebleed. It sounds right. You know, it's something that we all grew up doing. Your nose is bleeding out, and so we tilt our head back because if we can't see the blood isn't happening, right? Well, we're actually not supposed to be doing that. We want to lean forward and let that blood drain out, and then hold direct pressure over the bridge of the nose. We can start to consider stuffing some items into the nasal passages just to help with stopping that bleeding, forming blood clots on that broken vessel. But then we run the risk of, as we pull that tissue out, we might rip the clot out with it, and then the bleeding starts again. So the biggest thing is just to lean forward and hold the bridge of your nose, because we don't want to lean back and let this blood pool in the back of our throats, start swallowing this blood. That might cause aspiration. A lot of times that blood that people are swallowing can make them vomit, and so that's just another aspiration risk. And so as you're leaning forward and you're holding the bridge of your nose, the soft part of your nose, and the blood is stopped, you want to make sure that you're holding that pressure there, and ideally you want to do it for as close to 10 minutes as you can. You don't want to do it for a few seconds, then stop just to check if it's still bleeding, because then we're not really forming any clots. We need to make sure that we're holding and making sure blood clots form. The fourth mistake that most people make is they just start sticking their finger into somebody's mouth if this person is choking. And I'm here to tell you that that's not right either. Well, sometimes it's right. If you can look into the mouth and you can see the object, go ahead, get in there, scoop it out, pull it out, whatever you need to do to get that object out. But if you do not see that object, you are not going to start sticking your finger down into that person's mouth trying to find something, because we might just be pushing that object further down and deeper inside. So what we should be doing is, if this patient is able to cough, tell them to cough. Hey, cough as hard and as forcibly as you can. Try to force that object out. We also want to start doing the Heimlich and our back thrust on this patient. And so take a class, watch some videos on how to effectively do it, but you also want to make sure that you're following the most recent up-to-date guidelines for first aid. If the person who was choking now becomes unresponsive, unconscious, weak, limp, we're now going to help them down to the ground, and now we're going to start doing our chest compressions. And of course, like every other emergency, we are going to be calling 911 as soon as we possibly can, or telling somebody else, hey, call 911. The fifth mistake that most people make is when somebody falls or trips and they get impaled by an object, whether it's a piece of glass, a nail, a piece of metal. Our first instinct is to get that object out. It's not supposed to be there, so let's pull it out. Let's remove it from the body. And again, we're talking about mistakes, and so that is one of the mistakes that you can make, is pulling that object out. We are not supposed to remove any impaled object that goes into a patient. Although it is scary, and this is an emergency, and you should be calling 911, having that object impaled into the patient, that might be what's controlling most of the bleeding. Once you pull that object out, this patient might bleed out. So of course, call 911, and with that object still in place, we want to start stabilizing it. We want to start taking gauze, t-shirts, pillows, whatever we need to, and put it around the object, just so that it's stabilized in place and isn't able to move around and cause more damage. The sixth mistake that a lot of people make is when somebody's injured, somebody falls, somebody's in a car accident, your first instinct might be to help them get up, to help them get out of the car. And moving a patient unnecessarily could cause more damage to this patient. Now, of course, if where the patient is and is injured at, the environment is more severe than just your normal everyday kind of scenario, such as the car is catching on fire, the car is going into a waterway, kind of things like that, to where this person is going to be more injured or die by staying in that vehicle or staying where they were hurt at, then we're going to go ahead and we're going to remove that patient at that point. But if it's just a normal car accident and there's no risk of fire or anything like that, we want to keep this person there because they might have some neck or spinal injuries that we just don't know about yet. And by moving this patient around, we might start to paralyze them or cause severe nerve damage. So of course, call 911 or tell somebody else to call 911 and only remove the patient if the environment causes an immediate danger. Mistake number 7 that most people make is they try to make somebody vomit, induce vomiting for somebody who has ingested too much of a poison, too much alcohol, too much medication. And that's going to be your first reaction. Your first instinct is to start maybe stuffing something down this patient's throat just to cause them and make them throw up. And that's not always the best case scenario. If this person is severely intoxicated and you start making them throw up, they might not be able to maintain their own airway. And so while they're throwing up, they may start aspirating and they may start choking on their own vomit. Some of these things, some of these poisons that somebody might take, it might do a lot of damage coming back out of the esophagus. Although it did damage going in, it could also do more damage coming back out. But really, aspiration is going to be the main concern with these types of patients. And so really just call 911, call poison control, and get this person to the hospital. The 8th mistake that most people make is they start trying to give food and water to somebody who's unconscious, unresponsive. Maybe it's a diabetic patient and we want to start putting candy in this patient's mouth. Well, now this patient might start choking on something like that. And so if somebody is not able to maintain their own airway, is not able to swallow on their own, we shouldn't be stuffing anything into this person's mouth. Whatever object we do end up putting in their mouth may cause them to start choking. And so all we're gonna do for this person is make sure that they stay in a safe environment, but go ahead and call 911, just get that process started. The 9th mistake that most people make is they assume that if somebody's breathing, that they are still alive, that they do not need CPR. And so you might see somebody who looks like they're struggling to breathe. They aren't really talking, they aren't acting like themselves at all. They're doing really weird, really deep, gasping, agonal type breaths. And we just assume that this person is still alive. But that could be the first sign that this person is dead, that their heart stopped, that they need CPR. And so if you see somebody who looks like they're really struggling to breathe, they aren't really looking at you, they aren't talking at all, what you should do is, of course, call 911 or have somebody else start that process of calling 911. And then we can go ahead and feel for the carotid pulse, where the neck and the jaw meet. Hold it there for no longer than 10 seconds. And if there is no pulse, or if you just are not sure if there's a pulse, we're then going to help this person down to the ground on a hard, flat surface. We are going to start doing chest compressions, and we're going to start calling for the AED, the automated external defibrillator, if we haven't already called for it. We already know 911 is coming, so now we need the AED coming as well, so that we can start taking care of this patient until the ambulance shows up. The 10th mistake that most people make is you go ahead, you call 911, you get that process started, and then you leave, or you don't do anything. That is a mistake, and that can cost the life of a lot of people. And so calling 911, that is great, but ambulances aren't magic. It's going to take some time, 2, 3, 4, maybe even up to 5, 10 minutes for an ambulance, for first responders to even show up to help you, to help the patient. And so if all you're comfortable with doing is calling 911, then great, we at least started that process. But hopefully you feel comfortable enough to use those first few minutes after calling 911 to start trying to save this patient's life. Whether that's by doing CPR, whether that's by stopping the bleeding, whether that's by going and locking up the pets in the back bedroom. And maybe you're just unlocking the front door so it's easier for us to get inside. And so you don't need an ambulance and a medical certificate or medical license to tell you that you can help this person. There's so many things that you can do to help this person very directly or even indirectly, and that can change their life. So do you guys remember at the beginning of this video, I told you to keep tally of the medical mistakes and see which ones you knew and which ones you didn't? Well, Now I'm going to ask you guys to leave your response down in the comments for how many you got right versus how many you got wrong. And tell me something that you learned. And so that's the end of this video. And doing something is better than doing nothing most of the time. If all you can do is call 911 and get that process started, then perfect. You are doing something. You are helping this person. If all you can do is open up the front door, perfect. You are helping this person. Knowing a few emergency skills can help change somebody's life. So thank you guys for watching. Thank you guys for learning something new. Go ahead and leave a like, comment, subscribe, share this video. You might help somebody who then helps to save your life. So thank you guys for watching. Take care. See ya.